Welcome to the Recovery Channel. I'm Dr. Richard Whitney, Medical Director of Addiction Services at Shepherd Hill in Newark, Ohio. We're talking about the treatment of opiate addiction for those of you who might be addicted to opiates, who have loved ones who are addicted to opiates, or who just want to know more about this dreadful disease called opiate addiction. One of the medicines that's been around for a number of years is called Methadone. In New York they say Methodone, but we say in the Midwest Methadone. This is a synthetic drug which is never seen the inside of a poppy plant, and it's made synthetically in a laboratory and can be very, very important. This is a comic book showing about how these wonderful medications can be like superheroes coming in and save the day. This is Methadone Man and buprenorphine Babe. Now, methadone is an orally active, long-acting synthetic opioid. What does that mean? Orally active means it can be swallowed, it doesn't have to be injected. Long-acting means it lasts for almost a whole day, in most cases, sometimes more than a day. You don't have to take it every couple of hours. And it's synthetic opioid, which means it's cooked up in a laboratory. It is very useful for chronic pain disorders. Some people take methadone because they have horrible, intractable pain, and methadone allows them to function. So it can be used for that. And then someone back in the 60s said, I wonder if we use this on heroin addicts, if it would help them with their cravings. And lo and behold, in the 1960s, it had the potential to treat opiate addiction, and it's been used for heroin addiction and other opiate addictions ever since the 1960s. What happens is it produces a tolerance to the effects of heroin and other opiates, which means when my methadone dose is on board, I don't crave other drugs. If I use other drugs like heroin, I get no effect from it because it builds up tolerance to those effects, because it's a very powerful drug in and of itself. Methadone can be a dangerous drug. It has to be prescribed by a knowledgeable physician very carefully, and it has a special federal DEA license in order to prescribe methadone for opiate addiction. So only certain methadone programs can prescribe this for addiction. Usual starting dose is about 30 milligrams. It takes several days for the same dose to build up in the bloodstream. A lot of people trying to get high on methadone say, well, 30 milligrams doesn't do it, I'll take 60. Well, that didn't do it, I think I'll take another one, and it builds up in their system, and unfortunately they die of a methadone overdose. Very dangerous medication in untrained hands. But when people are on a regular maintenance dose, it suppresses their cravings for heroin and other drugs. Sometimes people can get well and stay off of opiates at a very low dose. Other people have to have 200 or 300 milligrams or more. Average dose is between 40 and 200 milligrams. Now, why are people so anti-methadone? You must not take methadone because you're not really clean and sober, because you're only substituting one drug for another. You're using a crutch, and the only way to get clean and sober is to have all drugs out of your system. Well, these are just, frankly, old-fashioned, outdated thinking. Almost like it's better to overdose and die, or get HIV, or get hepatitis and die of hepatitis, than it is to take a pill and stay clean and sober. It makes no sense. There's no logical reason whatsoever why this medicine shouldn't be used in carefully selected individuals who want to persevere with treatment by knowledgeable physicians. Okay? And unfortunately, if we had a treatment that would work like a magic wand, then that's what we'd use. If we use complete abstinence-based treatment and that worked as well, then that would be wonderful. But the drug-free state is neither achieved nor sustained by most heroin addicts, and that is just the unfortunate truth. When we combine it with counseling, we have methadone maintenance here, we have methadone maintenance plus counseling here, and what we have here are a decreasing proportion of what we call dirty urines, or urines with drugs in them. In other words, people with methadone get well, people with methadone added to a treatment program with counseling get well at higher rates. What else does methadone produce in opiate addicts? Less crime, very important. Less HIV, the AIDS virus, passing from person to person, very important. So what are our goals? We want to get into a therapeutic blood range right here where we don't have side effects, but we have enough to keep away cravings. And if we can just get in the sweet spot, this blood level that works, again, these are like blood levels for high blood pressure medication, for antidepressants, for a lot of other things. We want a therapeutic benefit, no cravings, without side effects and without cravings. Okay. In the next segment, we're going to talk about how we take care of regular, routine, very common problems in people with the disease of addiction, and that is how do we treat pain, anxiety, and sleep in patients with the disease of addiction.